Barker.
Hi.
I'm really worried. Someone told me that I could have a thin lining and that's why I'm having miscarriages. Is that true?
Yeah, well, first off, I'm so sorry that you're experiencing miscarriages. And it's not a very common reason to have miscarriages. There are many other things such as genetic and structural and hormonal, as well as inherited things like antiphospholipid antibody syndrome, which we would want to check to make sure you don't have, that are more commonly known to cause miscarriages.
Okay. If I do have a thin lining, how can we check for that?
Sure, we can do a pelvic ultrasound. However, you just don't want to do it at any time of your cycle. Obviously, if you just, had your menses, it would be on the thinner side. And if you are post-ovulation, it can be kind of compact. So the best time is right before ovulation. And we don't only want to see how thick it is, but we also want to look at the quality. I like to compare it to like a sandwich. There's usually 3 layers. We call it a triple layer. And so that's kind of also important to know.
Good to know. If we find that I have a thin lining, is there anything we can do to build it up?
Sure. And I do want to just, acknowledge the fact that I do put a little bit more stock into the quality of the lining as opposed to the thickness. I mean, I've had patients get pregnant on a 4.5 and 5 millimeter lining, which are considered thin. So I know that that can happen. However, if we did worry that it was on the thinner side, one way to address it would be to give you some estrogen. However, you have to be very careful. You don't want to give estrogen really early on the cycle because it actually can inhibit you from ovulating. So you have to have it timed specifically. But the more common way is sometimes actually getting your body to produce more estrogen on its own, which is kind of super ovulating you with medication to throw out more eggs, which can increase your endogenous estrogen.
Got it. That's really good to know. Thank you, Dr. Barker.
You're welcome.